Hello, my name is Jess, and welcome to Dyscalculia Research Revealed, an interview series where I speak with leading researchers in the field of dyscalculia. Together, we'll explore their most recent and prominent research findings and what these discoveries mean for educators, parents, and individuals with dyscalculia. Today, I'm delighted to be joined by the brilliant Kinga Morsanyi from Loughborough University. She will be sharing a snappy overview of her research on dyscalculia, current projects, and future directions. Good afternoon, Kinga. How are you doing today?
Hi, Jess. I'm good, thank you, and thank you for the invitation.
You're welcome. We're really excited to have you on the series. So, do you want to just give us a bit of a background about your career and how you got to the position you're in now?
Yeah, thank you. So I'm a reader in mathematical cognition. As you said, I work at Loughborough University. I'm a developmental cognitive psychologist by background, and I research. Currently I work at the Department for Mathematics Education. So a lot of my research is focusing on mathematics at the minute, but I have a background in research into high level thinking, reasoning processes, decision making, and motivation, anxiety, emotional aspects of learning and intervention. So it's kind of a broader set of topics. And I have a long-standing interest in neurodivergence as well. So I've also done research into autism, for example.
Mhm. So, yeah, that's a really wide range of psychology. So, what was it about dyscalculia that interested you, and how did you get into this area?
Yeah, so I mentioned autism. So I had this general interest in individual differences, neurodiversity, atypical development, and I was also lucky to be invited to be part of a research project in Cambridge when I did my first postdoc after my PhD. So which was all about dyscalculia and mathematics anxiety. So this was a really nice way of getting more into this research area. And I suppose I also just enjoy looking at topics with a real life impact.
Yeah, no, absolutely. I can very much agree with that and relate very closely. So, can you give us a bit of a an overview of anything that you're working on currently?
Yeah, so I have quite, as you could see, I have quite wide-ranging research interests, but one of the things which like we discovered as part of a previous research project is how much underdiagnosed dyscalculia is. So this is so we are currently working on a screener for dyscalculia, also trying to look at screening at different levels of education, so from primary school through secondary to higher education, university. I'm also quite interested in the role of contextual factors in dyscalculia. So we know that this is a neurodivergent condition, or sorry, a neurodevelopmental condition. But this doesn't mean that the environment doesn't have an impact. So I think it's very important to understand what are the kind of contextual factors which could impact on developmental trajectories and could be considered as risk or protective factors for dyscalculia. Another area is teachers' knowledge. So I think if we want to give good support for dyscalculia, it's important to understand what teachers know about dyscalculia, how we can support them to best support the students that they are teaching. I suppose a more kind of basic research kind of interest is how general are the effects of dyscalculia. So I suppose we call it a specific learning disability or disorder in mathematics, but actually what we can see is that it's broader than that. So it impacts on not just mathematics, but some other aspects of learning and also other areas of life. And within mathematics, there was for a long time just a focus on arithmetic skills, whereas now we know it impacts also other aspects of mathematics. And I guess maybe one more thing is mathematics anxiety that I'm interested in and how it differs from dyscalculia and at the same time how they co-occur and interact.
Yeah, so that's such a wide range of things that you're studying, and I'm sure we could talk about it all day. So my next question is, what how do your findings, or can you give us a key takeaway from your findings so far, and how does this relate to educators or parents or individuals with dyscalculia?
Yeah, so I think screening is very important. So our finding about underdiagnosis highlighted how much we should focus on identifying learners with dyscalculia, and then of course looking at how we can best support them. Also the developmental changes. So what happens throughout development. So I think this also has very important implications for teachers, but also parents, what you can expect. So it's not at all a stable condition, but we can expect changes with development. So I guess this is important, and it's not like something that I could say right now what
Yeah.
what is happening, but I think this is something that that we should research and try to communicate to teachers and parents. And I think, sorry, what was your question?
So
I'm
it was the
forgetting.
practical implications
Oh
of
yeah, I
something,
mean,
maybe
practical.
something.
So I think the practical implications are quite clear. For example, for teacher training, how we should communicate this with teacher, and I think also there is a lot of actually political or policy discussion about dyscalculia going on at the minute, exactly about screening, teacher training, and and I think we should talk to policymakers about these findings. So it's important that if it's done, it should be done in the right way. So, for example, screening should be available. Generally, it shouldn't be expensive. It should be much quicker than it is right now, when people have to wait sometimes years for a diagnosis, and then to have appropriate support in place once this happens.
Mhm. Yeah, brilliant. Thank you so much for that summary. So you've sort of touched on this a little bit, but what would you suggest future researchers prioritizes in the future?
Yeah, so I think maybe identifying dyscalculia is something that we already know quite a bit about. So the problem is really the implementation, that screening is not widely available, or it's too expensive. I think what we should also look at or understand better is individual differences. So each person with dyscalculia is unique, and so how we can take into account this diversity within dyscalculia, and not just try to use a one size fits all kind of approach. I think also co-occurring conditions are very interesting. So we know that actually, and this is where the whole idea of neurodiversity comes from, that it's not just different separate conditions, but we know that there's a lot of overlap and co-occurrence between conditions, and people often have more than or belong to more than one diagnostic category. So I think this is also important to further understand and research how kind of we can make sense of neurodivergence and this overlap, and like the kind of connections between different, but also the differences between different conditions. And I suppose it also links to my research areas, the impact of environmental factors, how important they are, how much we can actually modify developmental trajectories within dyscalculia, and at the same time genetic factors as well. So how much or how we can look at biological influences in relation to dyscalculia.
Mhm. Yeah, brilliant. Thank you so much. I really appreciate that. And hearing your insights, I feel like our audience will really value what you had to say today. So thank you so much, Kinga.
Thanks so much, Jess.
That's okay. Was there any other thing that you wanted to add, or any final remarks?
I don't think so.
No, good. That's just checking. So thank you so much for your time today, Kinga, and thank you for everyone who listened. My name is Jess, and that was Kinga Morsanyi on the Dyscalculia Network's Dyscalculia Research Revealed, an interview series. Thank you.
Thank you.